This is Hildegard Peplau. Okay, never mind. This is Hildegard. She was born in Pennsylvania in 1909 and was a fierce academic, having a diploma in nursing, a bachelor's in interpersonal psychology, a master's in psych nursing, and a doctor of education and curriculum development. Her main theory was on interpersonal relations, which emphasized the nurse-client relationships as the foundation of nursing practice. Nurses and clients must work together instead of having the client passively receive treatment. Her theory explains the phases of the interpersonal process, roles in nursing situations, and methods for studying nursing as an interpersonal process. This interpersonal process is the journey to achieve the common goal between the nurse and the client, and this journey is to serve as a maturation process and road to gaining more knowledge for both parties. These are Hildegard's 7 nursing roles. The stranger role. The nurse receives a client the same way one meets a stranger in other life situations. They provide an accepting climate that builds trust. The resource role. The nurse answers questions, interprets clinical treatment data, and gives information to the client. In the teaching role, the nurse gives instructions and provides training. It involves analysis and synthesis of the learner's experience. In the counseling role, the nurse helps the client understand and integrate the meaning of current life circumstances and provides guidance and encouragement to make changes. In the surrogate role, the nurse helps the client identify domains of dependence, interdependence, and independence, and acts on the client's behalf as an advocate. In the active leadership role, the nurse helps the client assume maximum responsibility for meeting treatment goals in a mutually satisfying way. In the technical expert role, the nurse provides physical care by displaying clinical skills. These are her stages. In the orientation phase, both parties become acquainted to each other in the nurse-patient relationship. Preconceptions are worked through and parameters are established and met. Early levels of trust are developed and roles are begun to be understood. In the identification phase, the client begins to identify problems to be worked on within the relationship. The goal of the nurse is to help the patient to recognize his or her own interdependent or participation role and promote responsibility for self. In the exploitation phase, the client's trust of the nurse is reaching the full potential. The client makes the full use of nursing services to solve immediate problems and identifies and orients himself or herself to discharge goals. In the last phase, the resolution phase, the client has met all of his or her needs. There is a mutual termination of the relationship. A sense of security is formed. The patient becomes less reliant on the nurse and increases self-reliance to deal with own problems.